Hi, I'm Dr. Shannon Ferguson, and this is Move Her to Lose It, and today I'm going to be talking about acute knee pain. There are many causes of acute knee pain. There's obviously the scary kinds, like inside the knee problems, so ACL, PCL, meniscus, stuff like that. If there's a ligamentous issue, that's a little bit more complicated than a simple stretching routine, although stretching will help, and physio is a huge part of getting knee pain to improve. But what you probably should be looking into is something called prolotherapy, which I absolutely love for any ligamentous or meniscus issue inside the knee. And it's a really simple injection and it works so well. So if you have an inside of the knee problem or you suspect an inside of the knee problem, make sure that you go to your doctor, get some imaging, rule out inside of the knee problem, and then look into prolotherapy. There's also outside of the knee causes of knee pain. So this is like tendinitis, an imbalance of muscle or fascia around the knee joint, or outside ligament issues. These are more easily addressed without injections or surgery. So this is the stretching routine that I use when I have acute knee pain. And I did a couple weeks ago. I noticed that during my workouts, I was experiencing knee pain and I was favoring my left knee. So this is the routine that I did to help my knee pain. And I also addressed my squatting form and how I was doing my workouts. So addressing the trigger for the knee pain is really, really important, but also stretching to help the symptoms. If ever you have new musculoskeletal pain, especially anything associated with joints, it's always good to go to your doctor first to rule out anything that's torn or something that needs a little bit more aggressive treatment. But this stretching routine is really great to help in the meantime with the symptoms.
Okay, to start off, we're going to be doing a hamstring stretch. So dorsiflexing the ankle, so bringing the toes up towards your face, and then leaning your hips back until you feel a stretch in the back of the thigh, so the hamstring muscle. I'm reaching toward my toes just to get a little bit of a better stretch, but you don't have to do this. If you have balance issues, make sure that you have a chair or a counter or something nearby so that you can grab it if you need it. Knee problems are very rarely just knee problems. It's usually a function of how your hips and your ankles are working and the mobility and the strength of everything around the hips, knee, and ankle. So for the acute pain and the symptoms of having knee pain, we're going to be stretching everything above and below the knee. But remember to look at how your hip and your ankle are functioning and to strengthen everything around all of those joints. So now we're going to be doing an adductor stretch. So this is from the inside of the knee all the way up to the groin. So I wiggled around until I felt the best stretch, and you should do the same. We're holding all of our stretches for 45 seconds, and I'm only doing one leg, and if you have bilateral knee pain, then you should definitely do both. But eventually, everything connects, so you have to stretch and strengthen everything in your body to maintain general pain-free range of motion. So my knee issues stem from the pes anserine tendon. So that's where the adductors attach into the inside of the knee. So it's really important for me to do this stretch. I also get prolotherapy right into that tendon. So prolo is not just for the inside of the knee. It's also really helpful for ligament and tendon issues outside of the knee. But a core part is strengthening hips, everything around the knee and ankle and feet, so that the reason the tendon is irritated stops. So this is a quad stretch. So femur straight up and down with your torso. You want your knees together. And to get a little bit of a better stretch, you can contract your glute to make sure that your pelvis is pointing forward. So you can also switch the angle of your ankle so that you can get different aspects of that quadriceps muscle, because there's four muscles in the quad, hence the name. And again, if you have balance issues, make sure that you have a chair or a counter or something to hold on to so that you don't lose your balance and fall. So now we're going to be doing a gastroc stretch, or the calf. So there's lots of ways to do the stretch. I also have a video on doing it against a wall, but this is a lunge style. So you want your foot to be flat on the ground. So the stretching leg is my left leg. So if you can't reach your heel all the way to the ground, that's okay. Just make sure that you have a stretch in the back of that calf there. Okay, so now we're going to do some foam rolling. So we're going to foam roll the hip flexors and the quadriceps. So remember that when you're foam rolling to go really, really slow. Going fast isn't going to get the same effect. And you can control how much pressure you're putting with your body to control how much it hurts. So if you don't feel much, you can try and put as much of your body weight into that foam roller as you can. And if it hurts too much, then you can put more body weight into your arms rather than onto that leg. So as you can see, I'm going through all of the angles of that quad. And then in here, I'm going up into that hip flexor, so right at the front of the hip, and rolling all the way through. Again, acute knee problems are often just the beginning of a chronic one. So whether it's acute or chronic knee pain, make sure that you're not just controlling the symptoms with stretching and foam rolling, but you're looking at changing your form of your exercise and making sure that your glutes are firing, and your hamstrings and your calves are all firing, and there's appropriate mobility in all of your joints. So this is foam rolling the adductors. So that's that pes anserine tendon. So putting the weight of your leg onto the inside of that thigh, and I'm concentrating around my knee because that's where it hurts the most. And then finally foam rolling the calf, so the gastroc muscle. This is a little bit harder to put a lot of body weight on, but it also tends to hurt a lot more, so it doesn't really matter as much. So you want to foam roll all aspects of that calf, so the lateral side and also the medial side, so the outside and the inside of that muscle. You can also foam roll for longer than this. It depends on what feels good for you, so play around with how much foam rolling you feel like you need. And there we are.
Thank you for watching my video on acute knee pain. I hope that you enjoyed it. If you like this video, please subscribe to get more updates on stretching and pain-free living.